seen a woman in pregnancy craving things like clay, ice, paper, sand. And another interesting thing is that this is more common in some areas. Hello, friends, you're welcome to another episode of Roy Mother Care Channel. I'm Rachel, a registered nurse and midwife, and today I'm discussing a very interesting topic alongside a midwife. Can you introduce yourself?
Hello everyone, I'm 𝗃𝗏𝗡𝙁. I'm a registered nurse and midwife.
Okay, so today, just like I said earlier on, we're discussing a very interesting topic, and this is known as pica in pregnancy. Tolu, can you quickly define what pica is to us?
Okay, Pica is a persistent craving and compulsive consumption of non-food items such as charcoal, clay, sand, even baby powder, and so on. And it must be on for at least a month for it to be diagnosed as Pica in pregnancy.
Okay, thank you very much, Tolu. So, just like Tolu said, we all know that there's this usual craving in pregnancy. You know, some women crave some things. For example, my culture, I'm Yoruba. I know some women in pregnancy they crave our local food, amala, a lot. They just want to keep eating amala and amala every day. Yes, because the local soup. While some people maybe crave suya, some people can be craving yogurt, and they just want to take it every day on and on in pregnancy. Now, this craving is different from the one we are talking about today. This speaker is craving non-edible substances. Like you see women eating clay, chalk, stone, and you're like, what's this? Yeah, so that's what we are discussing today. So there are some types of materials that some that women crave, that these women that have pica, there's some particular substances they crave. Some women crave earth materials like sand, rock, stone, which is known as geophagy. Yes. So what some
Mm,
other women crave some other
yeah,
substances like
yeah, like raw starches and example is uncooked
yes,
rice and is
yes,
also known as amylophagy. Some
yes,
other women also crave ice, which is known as phagophagy.
yes. So
Yes.
people crave all sorts of things, all sorts of things. Yes. So now we know the types of pica. We know what pica is, the types of materials people crave. So I'm sure that you'll be wondering that okay, what's the cause? Why is it that some women crave these non-edible substances while some women have the normal craving, which is LD? So what are the causes? Yes, so there are several causes, and one major cause that has been linked to pica in pregnancy is lack of nutrients. So you know from studies they have found out that most women that have this pica in pregnancy they lack nutrients like iron and some minerals, especially women with sickle cell anemia who lack iron normally, who have low levels of iron. So these women have been noted to have pica more during their pregnancies. Yeah, so look, can you
Mm,
just under cause of
yeah.
pica in pregnancy?
Okay. Another cause is cultural belief. So
Yes.
cultural belief also contributes to these behaviors. For example, in Kenya, they have this belief that while when they eat clay, it helps them with their fertility and also boosts their blood.
Okay, so another thing that studies have shown to be a cause of this pica in pregnancy is hunger. So some women engage in pica to satisfy their hunger, and you know these women that do this because of hunger, they mostly crave these geophagic substances like earth, like clay, just to satisfy their hunger. Yes.
Yes, okay. Some people also, due to stress, they
Yeah.
use it as coping mechanism for them, and also when they go through anxiety and depression and so on.
Yes, yes. So these are major causes of pica that have been identified. So yes, now I'm sure you'll be wondering like, women are eating short things in pregnancy, especially in pregnancy whereby the baby, the fetus is also involved. So I'm sure you'll be wondering that are there no effects for the mother and effects for the baby most especially because you know the mother is grown and her immunity will definitely be more, although it's reduced during pregnancy, but at least it can't be compared to that of the fetus. So yes, there are risks or there are effects with this pica. And funny to note and very interesting is that there are negative effects and there are also positive effects. Yeah, for the negative effects, we have the risk to the baby. You know, one major risk to the baby is that the nutrients, like healthy nutrients that the baby is meant to get, this the mother is craving are competing with the healthy nutrients, so not making it available or sufficient for the baby. And also there could be metal poisoning because if the mother consumes things like metals, so there could be lead poisoning inside those metals, which could be toxic to the growing fetus. Yes, and another negative effect for the mother too, there could actually be lead poisoning in the mother, and also there could be iron deficiency. You know, now we've identified that one of the major causes of this pica is lack of nutrients. This mother lacks iron normally. So instead of her to replace this iron that she lacks, she's eating something that is not even giving her nutrients. So it could lead to iron deficiency. And also helminth infections, that is worm infections. Women craving or consuming clay, sand, and the likes. Worms could be found in these things and could lead to worm infections. Yeah, Tolu, could you tell us the positive effect of this Pica? Yeah.
Yes, the positive effect is that it protects against harmful pathogens in the body.
Yes, yes.
Yes, and there are some bacteria in the body. They are known as normal flora. So when they are in the right place, they prevent the body against some other harmful bacteria. They can be in the gastrointestinal tract,
Yeah,
on the
those are
skin.
like normal flora.
Yeah, they are normal flora in the body.
Yes,
They are not
yes.
harmful. So this is one of the positive effects of
Yes,
Pica.
but this positive, look at the negative, it outweighs the positive.
Yes,
So I'm not saying people should engage in
in
Pica because you
Pica.
can say that, oh, it has some negative. No, it's very minimal. Yeah. So now we've talked about what Pica is, and you know what Pica is. You know the types of substances that women can crave for that are non-edible. Now you know the causes, you know the effects. Yes. I'm sure now the next question you ask is, how can one manage it, especially at home? Like, what are the things a woman can do if she's craving these non-edible substances in pregnancy? Okay, the first thing is when a woman conceives, that is when a woman gets pregnant, she should start attending antenatal care at the appropriate time so that our healthcare provider, whether the doctor or the midwife, can review her health status with her, know whether she's iron deficient, for example, in cases of sickle cell anemia, and then do the right thing. You understand? Another thing also is for people that are iron deficient, after their healthcare provider has reviewed them, they could place them on iron supplements so that they won't be deficient, which can actually lead to Pica. Yes. So can you tell us some other management for
Okay,
Pica?
so whenever you have these cravings, so you can substitute these cravings with sugarless gum to actually
Yes.
help instead of
Yes.
eating stone,
Non-edible
clay.
things.
Yes, you can
Yes.
eat sugarless gum, and also
Yes.
talk to someone about it. Talk to your partner, your friends, to help
Yes.
you out whenever you have that craving. So they
Yes.
can help you get substitute for the
Yes.
cravings.
Yes. So thank you so very much. So we've come to the end of this video. We've been able to learn about Pica in pregnancy. Now I know you are informed about Pica. So when next you see a pregnant woman craving non-edible substances, you are better informed. You know what could be the likely cause and you know how to help her out. Yes, so thank you very much for staying to the end of this video. If you've ever had Pica in your pregnancy, we'd like you to share your experience with us in the comment section. Or if you've ever seen a pregnant woman that had Pica in her pregnancy, or if you have questions, kindly engage us in the comment section. And don't forget to like, share, comment, and subscribe. See you in the next one. Bye.